Many states and cities and counties are now easing COVID-19 restrictions put in place months ago when coronavirus first hit. That has many of you questioning whether social distancing and other safety guidelines are still necessary. KELOLAND's Brady Mallory has the answers for you and looks at the current state of the COVID-19 pandemic.
It feels like a new chapter. Local businesses are beginning to reopen, and more people are starting to go more places, which brings up a very important question.
Is the pandemic over?
The short answer is no.
Dr. Dan HEINEMANN, a vice president and medical officer for Sanford Health, says scientific data shows COVID-19 will be with us at some level through the end of the year and possibly early into next year.
Because we're reopening and because businesses are opening, I think people must feel that this threat is no longer as serious as it was, say, 6 weeks ago when we first encountered it. But that's really far from true. I mean, this threat is still there.
Dr. HEINEMANN says now is not the time to stop social distancing, nor should you ignore CDC safety and hygiene guidelines, like washing your hands, wearing masks, and disinfecting surfaces. He says nearly 40% of people with COVID-19 don't show symptoms. That means you could give COVID to someone else without even knowing.
It continues to exist by infecting others. And the only way to break that chain is to not give it a host to infect and then reproduce so that it can infect another host.
And I think it's important to note what you're saying is you're not telling people to just stay home under a rock and not do anything. It seems like you're telling them that you can dip your toes back into society, but you just can't stop practicing these safety guidelines. Is that correct?
For right now, yes, that's correct.
Many of us are ready to turn the page on COVID-19, but Dr. HEINEMANN says we still have to be cautious when going out because we really don't know when the pandemic will end.
How much we've learned about this virus since it started, but how much more we have yet to learn. The true story of this whole thing is going to be written 2 or 3 years from now when we really understand what happened.
Brady Mallory, KELOLAND News.
Now, we also asked Dr. HEINEMANN when it will be safe to visit loved ones who are among the vulnerable population. He says we should wait and see what happens as we reopen before we deem it safe to visit someone who could easily get sick. He says more tests could be key to answering that question.